Welcome back to the Leukopak Lady. Today I'm going to talk about mobilized leukopaks. These are bags of white blood cells that are enriched for hematopoietic or blood stem cells. They're collected from healthy donors and patients following the administration of a drug that calls their stem cells out of the bone marrow and into the peripheral blood, where they can be collected by automated apheresis. Blood centers and oncologists typically call this blood product HPCA, and it's classified by the FDA as a tissue. The use of mobilized leukopaks has been primarily for patient treatment, either autologous stem cell transplant following chemotherapy, or for allogeneic stem cell transplant, where the collected product from a healthy donor is given to a designated matched patient. Bone marrow donation can serve these same treatments, but it's now considered a little safer and easier to collect the cells by apheresis for both the donor and the patient. So mobilized leukopaks are also being used in FDA-approved autologous gene therapies for blood disorders like sickle cell disease and beta thalassemia. In addition, iPSC lines are generated from blood stem cells that are isolated from leukopaks, and these can be used for off-the-shelf allogeneic treatments. The mobilization process can be a little bit difficult on the donors and the patients. I can speak from experience here as a donor. The mobilization drug, called neupogen or GCSF, causes like an allergic reaction that manifests as bone pain. And this bone pain feels like prolonged growing pains. It also can enlarge the spleen, which by itself is not dangerous as long as the donor or the patient doesn't get hit in the abdomen very hard while they're on the drug. So that's all for today. On the next episode, we will talk about manufacturing issues that developers experience from inconsistent starting materials like leukopaks.